Well, for many women, the results of breast augmentation can improve their self-esteem, just make them feel better all around. I'm joined today by plastic and reconstructive surgeon, Dr. Kailash Narasimhan, and we're going to talk a little bit about this today. First of all, for breast augmentation, are implants safe, and what types of implants are available?
Well, the different types are in general silicone and saline implants, and they come in different variety of shapes and sizes. They're round, there are shaped implants that are actually shaped like a breast, and they come in different textures. Depending on what need that's required, a patient might be a candidate for one or another. In general, you know, the safety issue is not much of an issue. The silicone implants have shown to be very safe. They have good longevity, and there have been no major adverse effects, and they're all FDA-approved devices.
Okay. And how long is the recovery time with those implants?
So the recovery, I usually say about 6 weeks, depending on how the procedure is done. If the implant is placed under the muscle, there's more recovery because the muscle needs some time to relax and adjust to the implant. But usually that's the time frame, depending on what the patient's work and their activity afterwards.
Okay. Now, sometimes women, this is an elective thing for them, and sometimes if you're dealing with a cancer survivor, they want to improve their self-esteem too, and they just want to feel like they used to feel. So what's the difference in the procedure versus, you know, for just the elective versus when you're dealing with a cancer survivor?
Well, in someone that has cancer, you know, the implants that we use are a little bit different usually. Also, you know, we're dealing with someone that doesn't have any breast tissue, so we have to recreate all of the breast with an implant. There's a little higher risk of complications too, and we use drains, and it's usually a few scheduled procedures. But you know, the implant material is the same. But you know, I think that there's certain cosmetic aspect to the reconstructive surgery too, because you know, the women want a very shapely breast, and they have different goals in terms of what they want in terms of how their breast is going to look and what they expect.
Sure. Okay, so who does this surgery for an augmentation, and where is it performed?
So I think that's important because there's a lot of people getting procedures in the Texoma area. I think patients need to make sure that their surgeon is certified by the American Board of Plastic Surgery. That's the gold standard for cosmetic procedures. Also, the procedure should be performed in an accredited operating room. It shouldn't be performed in the office or under local anesthesia or anything like that. And you know, when I talk to patients, when it comes to their welfare and their safety, they shouldn't settle for anything less than the highest standard. That's what I always tell them. So,
absolutely.
Yeah.
All right. Dr. Narasimhan, again, thank you so much.
Thank you.
We'll be back after the break.